Okay, well, I want to welcome you to the webinar today. I am just really excited to share this information with all of you. Let me just bring my PowerPoint up here, and we will get started. The topic today is osteoporosis, and I just want to stress to all of you who are watching the webinar that you do not want osteoporosis. And there is so much that you can do to prevent it, and for people who actually have it, so much you can do to prevent fractures and prevent falls. So I really want to encourage everybody watching to be get out of that reactive mode, waiting until something happens, and be proactive. The statistics about osteoporosis are just really alarming. Lots and lots of people affected by this, 10 million in our country, most of whom are women. But there are men also affected, and another startling statistic, I think, is that half of the women and a quarter of the men over the age of 50 at some point in their lifetime will have an osteoporosis-related fracture. And that is a major event, because once a person has a fracture, the likelihood of them getting another fracture goes up exponentially. So as a health educator, I just love to share this information with people because there is so much we can do. So let's start out by talking about what really is osteoporosis. And the slide that you're seeing, if you took a bone, a healthy bone anywhere, I mean, bone is hard, right? You hit yourself in the forehead, that's hard. And this, if you slice bone open and put it under a microscope, this is what normal bone looks like inside. It's very dense. It's very tightly knitted, if you will, very strong. But when you get osteoporosis, this slide is showing you on the bottom how this honeycombing effect takes place. There's just big holes throughout the bone matrix. And this makes the bone very, very brittle, very easy to break. So there are some things you can do nothing about as far as your risks for osteoporosis. However, there are several things that you have control over. And, as you saw, it happens more frequently in women. Can't change that, although I guess in this day and age you can change from female to male, but it's not going to change your risk for osteoporosis. Postmenopausal, less estrogen, or if you have early menopause, these are risks that can happen that you can't control. If you have a mother, a grandmother, a sister, an aunt who had osteoporosis, that increases your risk. As we get older, if we are Caucasian or Asian, that also increases our risk. And slender body build, it's one of the few times when we talk about being slender as being a risk factor. But being underweight is especially what we're talking about. Now, things that are in a person's control to prevent osteoporosis, prevent the risk of fractures, is to stop smoking if you do smoke. And remember that if you have smoked in the past, that does increase your risk. Being physically active, meaning weight-bearing activities for your lower extremities, walking, running, jogging, any of those, dancing, all of that is weight-bearing. But you need to do something for your upper extremities. You need to do some weightlifting, whether that's with weights or soup cans or whatever you're going to use. But it has to be something that's going to stress the bone a little bit. It makes it more active and repairs itself better. Excessive drinking is a risk factor, a big risk factor for osteoporosis. The medical recommendation is for women no more than 1 alcoholic beverage a day, and for men no more than 2. Vitamin D in normal levels is essential. Calcium is based on what your age is, the amount of calcium intake you need, and we'll go over that in detail. If you have an abnormal thyroid and it's producing too much thyroid, that excessive thyroid is also a risk factor. And you can also control your BMI. We don't want to be obese because that interferes with vitamin D. We don't want to be underweight because that increases our risk for osteoporosis. So we'll talk about more of these as we go through this. But often osteoporosis is just considered a silent disease because if you haven't been tested, if you don't know your risk factors, you're not going to usually know you have it until you break a bone. And indeed, sometimes people don't even find out then because you break a bone, you go in and it's x-rayed and taken care of, and depending on the provider that you see, they may or may not think, oh, this person has these risks for osteoporosis, or may not ask you and just consider it a broken bone. So you need to be proactive. If you break a bone, you want to talk to your provider about risk factors for osteoporosis and get additional testing. And of course, once you break a bone, you have pain, right? Right away, it hurts. Now, the most common sites for osteoporotic fractures are in the hip and in the spine. The picture on the screen with the curvature of the spine, starting at age 35 is the first picture. At age 25 is when our bones are at their healthiest and densest and strongest. And from there if we don't take proactive action, we can have a declining bone density, and that can lead to fractures in the spine, which is what causes the curvature of the spine and causes people to lose height. There's very few other conditions. There are one or two, but most of the time when you see an elderly person that has what we call the dowager's hump and they're all hunched over at the shoulders, usually because they have compression fractures in the vertebra. And you can see on this slide on the right-hand side when the fractures have occurred and there's loss of height, you can see this is where they started out. They gradually lose height as those fractures occur. But the other things that happen, the belly's very protruding, right? Because the spine becomes, less straight. And then the curvature in the upper spine causes the head to be forward. That creates pressure on the chest. So osteoporosis can even cause problems with digestion and breathing because of those problems with the pressure in those areas. So this is what a vertebral or spinal fracture looks like that results in loss of height. Up at the top we have a normal vertebra, down here we have a normal vertebra, but this one in the middle you can see it's compressed, right? So when we talk about broken vertebra, broken spinal fractures, it's just that they just collapse down on each other, and so that's how the height is lost. So how do you know what your bone mineral density is? How do you know how healthy your bones are? Well, this is done with a DEXA scan, and that measures your bone mineral density, known as the BMD. So everybody, age 65 and over, at that age, you should be getting a DEXA scan to see what the health of your bones is. Remember, we said it increases with age. But all those risk factors we mentioned earlier, if you're 50 or over and you have those risk factors, that's when you should start getting the DEXA scan done to assess where you're at. Now, there is a number that is reported when people have a DEXA scan, and that number is simply called the T-score. That's what it is. It's the number that's reported by the DEXA scan. Now, normal bone density, good, healthy, strong bone, that T-score number is going to be -1 to a +1. Okay, that's normal. I don't know where they come up with those exactly, but that's what normal bone is. So that's what you want to have. Osteopenia is the medical term for when bone starts to thin. It's more susceptible to fracture, and that is a T-score of -2.5 to -1. Okay, anything in there is considered osteopenia. You're high risk for osteoporosis, have some increased risk for fracture, and osteoporosis itself is when that T-score is -2.5 or a negative higher number. So important to know where you're at. This slide I just had to put up because it was something new to me when I was doing the research for this presentation. In fact, it was from one of our local physical therapists here in the community that I live in, had written an article in our local paper not too long ago in a health section. You know, vertigo, when you change position, some people get dizzy, and that might mean that the room is spinning or they feel like they're spinning. But research is really suggesting that if people have osteopenia, thinning bones, or osteoporosis, the full-blown disorder, that correlates with this, what we call positional vertigo. And for years, we didn't ever really know what caused this to happen, but it's really caused by crystals in the inner ear that cause this sensation. Now physical therapists can do simple movements that will relieve this problem and teach you how to do it yourself. But that's that's neither here nor there with the topic of osteoporosis, except I had never heard of this correlation between osteopenia and osteoporosis and this positional vertigo. So it was just an interesting fact I had to share with you. In fact, my husband has a friend who suffers with this, and we were sharing with him, you know, these exercises that can be taught to alleviate this. So I suggested that he also get checked for his calcium vitamin D levels and osteoporosis potential. Anyhow, what can we do for treatment and prevention? Well, of course, there are drugs, there are pharmaceutical options. Calcium is essential, vitamin D3, vitamin K2, magnesium, vitamin C, trace minerals. These are all necessary for the proper absorption of calcium so that the body maintains healthy bone structure. The weight-bearing activities we mentioned, and preventing falls. If anybody has osteoporosis or even osteopenia, they really need to be proactive in this area. No scatter rugs. Get their vision checked. If they have glasses, wear the glasses. If you're using, excuse me, extension cords or anything like that, be sure they're out of the way so that you're not going to trip on them. Toys, grandkids come over, get the toys out of the way. Some medications will make people dizzy. Talk to your provider. Get off those medications. Good lighting, stairways, bathroom, hallways, all very, very important. Preventing that fracture is essential, and I can't stress enough, if anybody smokes, absolutely stop smoking for many reasons, but this, you know, young people who smoke are not thinking about ending up in wheelchairs for the rest of their life or in a nursing home the rest of their life because of this debilitating and disabling osteoporosis. So the pharmaceutical options, I'm not going to spend a lot of time on, but there's 4 different categories. Now, the bones in our body are constantly undergoing what we call remodeling. Old bone is being removed and new bone is being laid down. We get a new skeleton every 10 to 12 years. Now, the one category of drugs is called anti-resorptive drugs. And you can see the names on the screen, the Fosamax, Actonel, Evista, Beniva, Calcimar, Reclast. These bones actually kill off the cells that are removing old bone. So that's one group of drugs. Estrogen is another drug therapy that is beneficial for osteoporosis because it prevents bone loss and helps increase bone mass. Doesn't mean all women should go on estrogen because there can be some negative side effects there, but it is very effective for that. And then we have what are called selective estrogen receptor modulators, which is a mouthful, abbreviated to SERMs. And for people who can't take estrogen, they work kind of like estrogen, but they're not estrogen. So tamoxifen and Evista are the most common in that category. And then anabolic drugs, there's really only one that can actually build new bone. I actually worked for the company that makes this drug for several years doing education of how to start it because it's injectable. It's a synthetic form of the parathyroid hormone, and it's the only one, as I said, that can actually build bone. So a very small percentage of people use this, but for those who have absolutely, you know, multiple vertebral fractures and that sort of thing, it can be very beneficial for quality of life. We talked about hormones, and I just bring this up because if you do have inadequate estrogen and you're having symptoms, replacement therapy needs to be based on actual hormone levels. In other words, you need to go in to see your provider and get blood tests or saliva tests done to measure your hormone levels. And I wanted to make sure everybody knows that this is just a simple self-assessment for potential imbalances of the sex hormones. It's on my website, and I don't know if this is going to come across on the recording or not, but I'm just going to click on the link here so those of you who are watching live can see where this is and what it looks like so that you can go there later. It's actually part of my weight management page. So I just went to judygilman.com, and the weight management page has a drop down. It says menopausal ? And here's a self-assessment of potential hormone balances. So if you take this and print it off and just check off those things that are positive for you, you can then go in and talk to your provider and see if you need to have some hormone replacement to get you back in balance. That affects so many things, many other things, and including osteoporosis. I really have to say at this point, I am not a fan of Provera and progesterone. Provera and Premarin. I lost my thought there. So I encourage you to discuss with your provider the current options that are more natural, like patches, or the drug doesn't need to go through your liver. Troches, sublingual drops, topicals, just depends on what is the best for you. But that is something that you need to consider in the aging process. Now, the osteoporosis drugs, other than the estrogen, well, of course, estrogen can have some side effects as well, but speaking about the other osteoporosis drugs, there's some really serious side effects that have come out over the last few years. And they have been so frequent and pronounced that the FDA, Federal Drug Administration, now recommends that providers don't use them for more than 5 years unless there is a much greater risk of fracture than there is risks of these things happening. But in a drug that's meant to prevent fractures with osteoporosis, some of them can cause these very unusual fractures, like in the thigh bone, which that's not a common place for osteoporosis to affect, but just stepping off a curb and the thigh bone, the femur just snaps. There's been esophageal cancer. There's been osteonecrosis of the jaw just crumbles. I mean, dentists will often refuse to do dental procedures like extractions and that sort of thing if women are on those drugs. So really discuss with your provider if you're on these kinds of medications and the duration that you should continue. And then there are drugs that you take for other health reasons, a long list of them here, and this I'm sure is not all inclusive. And they can be and these are prescription drugs then that may cause osteoporosis, and some that aren't even prescription. For example, the first one on the screen is antacids that contain aluminum. So read the label. If you're experiencing heartburn and you're taking antacids over the counter, check to make sure they don't have aluminum if you're taking them with any regularity. Some seizure medicines, not all of them, but dilantin and phenobarbital are two. Some of these newer drugs, Femera, you hear some of these advertised on TV. Cancer, chemo drugs. I mean, these are life-saving drugs. You're not going to say, no, I don't want that because I don't want to get osteoporosis, because if you're dead, it doesn't really matter, right? So I'm just pointing these out that these drugs can increase the risk. Heparin, lithium, Depo-Provera, methotrexate, which is used for a lot of autoimmune diseases. And speaking of heartburn, people take Nexium and Prevacid and Prilosec. Those are getting more and more commonly reported as leading to osteoporosis. So much better to avoid the foods that cause heartburn, get on a good, healthy nutritional program, including balance with a fiber that's going to get rid of the heartburn to start with instead of risking getting osteoporosis. And then there's these antidepressants, Lexapro, Prozac, Zoloft. Steroids are the most notorious of all. Again, life-saving drugs, but just so much increase the risk of osteoporosis. In fact, the drug I mentioned that builds bone, Forteo, even has an indication for steroid-induced osteoporosis. Tamoxifen is kind of a double-edged sword because sometimes that's used with for osteoporosis. And then there's a couple of diabetes drugs in that category that Actos and Avandia fall in. And if you have thyroid that is producing too much thyroid, that is another thing that will increase the risk of osteoporosis. So that's the pharmaceutical side of things. Now, calcium is so important for healthy bones and healthy teeth. However, too much calcium is going to increase the risk of heart disease because calcium will build up in the vessels if we have too much. And what most people think is when they read the recommendations for calcium per day, they think that's how much they should take in a supplement. And in reality, it's the total amount. What you eat, drink, is where you get most of your calcium, and then you only supplement the difference to get the total that is recommended for your age. And so that is what it's based on, is your age. So you can see on this slide, kids, 800 milligrams, 10 and younger a day. Men, premenopausal women or postmenopausal women that are taking estrogen replacement, 1,000 milligrams a day. So just write down where you fall in this category. We'll build on this here in a minute. Teenagers and young adults are still building bone, so a little more recommended for them. After menopause, if people are not taking estrogen, 1,500 milligrams, and pregnant and nursing mothers between 12 and 1,500 milligrams a day. So where do we get calcium from food? Well, I don't have milk on this slide, but I think everybody understands that milk is a primary source of calcium if you drink milk. And I will just say that people are drinking a lot of different kinds of milk now. If you drink cow's milk, it's about 270 to 300 milligrams of calcium in an 8-ounce serving of milk. So depending on how much, that's what you get in cow's milk. And it doesn't matter if it's skim or low fat or whole milk. I personally recommend whole milk, but it all has the same amount of calcium. But a lot of people are drinking almond milk, soy milk, coconut milk, so you need to look and see how much calcium you're getting in whatever kind of milk you're using. And then the green leafy vegetables, beans, seeds, nuts. I just had a question. Let me see if I can bring that back up here. Will milk cause a risk of heart disease if you drink fat-free? Milk is not going to cause heart disease, and I am not a proponent of fat-free and low-fat. I believe in whole food and real food, and so whole milk. In fact, if you want to get more information on that, on my website under the recordings page, there's a section on good fats, bad fats, and that's addressed in there. So no, and again, in moderation, everything, but that's not considered a risk factor for heart disease. Thank you for the question. Sardines and other saltwater fish, nuts, oranges, these are just some examples of where we get calcium in our food. Okay, bear with me here. My screen just froze up. And my slides won't move forward. Can someone just send me a text and let me know if they can still hear and see me okay? The screen? Okay, so I'm just going to keep. Okay, thanks. I don't know why my PowerPoint suddenly rose up here. My total screen froze up. So thanks, everybody. I know you can see and hear me. I just can't move my screen. Oh, there we go. Okay. I don't know what happened there. Temporary temper tantrum. So this was an interesting website that I found. It's, as I was doing research, what's the best milk for you? Like I said, we drink lots of different milks. So again, I'm just going to click on this link and show those of you who are on live, and hopefully those who are seeing the recording will see this as well. But it's from lifescript.com, and it's called What's the Best Milk for You? And so if you have a preference for a milk other than dairy, cow's milk, you can go through. There's like 9 different pages down here. You can scroll through, and it will take you to the almond milk and the soy milk and coconut milk and all of those. So you'll want to visit that site and get a little more information from that. And I will send that link out to you as well, those of you that are on live. So how do we know how much we eat and drink in a day so we know how much to supplement? Well, again, this is a great website on WebMD to calculate. So I'm just going to click on that and take us there. So it's webmd.com, the calcium food calculator. And it's just really, really cool. It doesn't have all of the foods on there, but it'll give you a good idea. So how much calcium are you getting? So you just have to check your gender. So let's just say that you're a female and you're 19 to 50 years old, and then you just choose which foods that you ate that day. So let's say that you put your cursor in there, and then you have to put a serving. So it tells you 1 ounce of cheddar cheese has 204 milligrams. I just had a slice of cheddar cheese before I started this program, so I know that from that I got that much. So if you're a cottage cheese fan, 206 milligrams in a cup, that's a whole cup of cottage cheese. If you had some broccoli, 1 cup serving. Again, if you had less or more, you have to change the amount. Then let's say that I had some almonds, and it says 1 ounce is 24 nuts. So we'll choose that. And then we'll just choose the soy milk down here, 1 cup, 300 milligrams. And then down at the bottom, you can calculate how much that came up to. So for this person, it then tells you on the next page, the total calcium in the foods that I selected was 847 milligrams. And at that age, whatever that was, I can't remember what age group I picked up to 50, they're supposed to have 1,000 milligrams a day total. So that means 95, they need 153 more milligrams of calcium to meet their goal of 1,000 milligrams that day. So I thought it was a really cool way, because you don't, like as I said, you don't want to have more calcium than is recommended for your age. So you need to keep within that guideline. If you're already getting most of it in your food, maybe you just want to go have, you're going to have another glass of milk or whatever, and you don't need your supplement that day. As we get older, that number goes up, so usually you do need a supplement. So I will send that link out as well. Most people only need 200, somewhere between 200 and 500 as a supplement once they figure out what they're eating and drinking. Another question I'm asked a lot, what kind of calcium is best? Because there is different kinds of calciums. So when you're looking at supplements, calcium citrate malate is the most bioavailable, meaning it's going to get in there and work the most effectively to support healthy bones. So that's what I recommend. Vitamin D. Can't absorb calcium if you don't have adequate vitamin D. Critical for that. Recent research over the last decade or so is showing that having adequate vitamin D decreases risk for falls, which of course is very important in this population of people. And it's almost, and by some experts, is acting like it's not a vitamin. It's acting like it's a hormone because it affects so many other conditions. Low vitamin D depresses the immune system, higher risk for breast, colon, prostate cancer, high blood pressure, depression, obesity, even increased incidences of asthma flare-ups. So very important to have enough. So why wouldn't we have enough? Well, we've been indoctrinated to use sunscreen, right? If you're using a sunscreen of 30 or greater, the vitamin D from the sun has to be synthesized on the skin, and that can't happen if you have that sunscreen on. So 15 to 20 minutes, several days a week is recommended without sunscreen. Put it on after that. Now, if people have very dark skin, they need 3 to 5 times that length of time in the sun. That's not good for the skin. People living in the northern latitudes, I mean, I live in Montana, so there's a lot of the year where there's very little sunshine, and when there is sunshine, I'm often not outside because it's cold. People who are obese have low levels of vitamin D. As we get older, we're less able to synthesize it, or we might not be in the sun as much, or maybe more likely to use sunscreen. And I just really believe there's got to be a lot of other things that we don't know yet. This deficiency of vitamin D is very widespread. Men, women, children, older people, and even people in the South. So how do you know what your vitamin D level is? Well, it's a blood test. And the blood test is called 25-hydroxy. That's just kind of the technical name for the test, but they're measuring the vitamin D3 level. And there's different organizations that determine what is normal and what isn't, but the most common is the Endocrine Society. The endocrinologists are the specialists in glands, whether it's pancreas for diabetes or thyroid, and so on. So they come up with the vitamin D levels, and they're measured in what is called nanograms. So you are deficient. You are in an unhealthy range if that number is less than 20. You have an insufficient amount to be healthy. If it's 21 to 29, you have sufficient to be healthy if it's 30 to 100. Now, that is a big discrepancy, 30 to 100, isn't it? It's hard to get too much vitamin D. If it's over 100, people recommend, they need to cut back a little. But most integrative, holistic providers that really are looking closely at what vitamin D does are recommending that people be in the higher limits of this sufficient range. I'll just tell you my own personal story. When I very first had my vitamin D tested, I was 28. So I was down in this insufficient area, and this is several years ago. And at that time, the vitamin D recommendation was much less. It was very inadequate. So, of course, my numbers didn't get better. I didn't get into the good range with that. Started taking more and more and more. And I'm not going to tell you what I'm taking now because everybody is different. You have to have the blood test. And I don't know about you folks. Your insurance may or may not cover it. Your doctor may or may not order it. I have a lab we have a couple labs in the community that I live in. We can go in and order the blood tests we want. They're mailed to us to find out where we are. I have finally now gotten into the sufficient range. I think my last number was 58. So very important to know that. And besides sunlight, again, it's added to milk. Fortified milk has vitamin D. It's in cheese and butter, margarine, cereals, saltwater fish. And if you're taking supplements, which most people have to do to get enough, if they're extremely low, I mean, it's thousands of units that people may need, you want to choose vitamin D, not vitamin D2. Both of those are available, but vitamin D3, there's actually a decrease in mortality with vitamin D3 versus D2. just throw that in there. These particular facts come from research that Dr. McCullough has done. He is an internal medicine physician who has an integrative practice and researches vitamin D and many other things very extensively. D3 is approximately 87% more potent as far as raising and maintaining your levels, and it's converted into the active form that your body can use 500% faster than D2. The animal sources of food that we get vitamin D from, that's the D3, and plant-based are D2. There's nothing bad or wrong with D2. It just takes a very long time for it to get to the active available stage. And liquid or powder supplements are much better than pills as far as getting absorbed. So what else do we need for calcium absorption for healthy bones? Well, we need magnesium. This is an element that is just involved in hundreds of enzymatic reactions, including bone growth. And the recent research shows that we need a 1-to-1 ratio of calcium and magnesium in the bloodstream to have maximum absorption, and 2/3 of the population are deficient in magnesium levels as well. So another thing you might want to talk to your, ask to have tested sometime. Another thing that's necessary, I mean, there's many things required to have good calcium absorption. It's not just simple calcium that you want to take in a pill. K2 supports those osteoblasts. That's the ones that lay down new bone. Also, calcium transport it's involved in that. Vitamin C improves the bone mineral density, and there's trace minerals that we also need for bone growth. And what I'm so excited about to talk to you today is a brand new product called Bone Fortify, a brand new supplement that is in the category of genomeceuticals. You've heard of pharmaceuticals, that's the drugs. You've heard of nutraceuticals, that's the nutrition-based things. The genomeceuticals is a brand new category of products that actually regulate the genes. So Bone Fortify regulates the genes that are involved in calcium and magnesium uptake, as well as the genes that help with the collagen formation that happens in the bone cells. It's a delicious berry flavored powder, and all of those things that I talked about, it meets the needs for that. It uses the right kind of calcium. It's the calcium citrate. There's 300 milligrams per scoop. This is a little teeny scoop that comes in this container of powder. So what I like about that, based on what I just told you about we don't want too much calcium, we want to supplement what we don't get in our diet, you can adjust the dose depending on what you need that day. And it has this exact ratio that's being recommended with magnesium. Same amount of magnesium as calcium, so it's a 1-to-1 ratio. And then it's got 2,000 of D3. It's got vitamin C, vitamin K2, boron, the trace minerals, all the things that are going to make this very bioavailable. So I want to just show you quickly how you can order Bone Fortify. Now, some of you listening to this or watching this webinar already have your own account. So you just go on your account and search for Bone Fortify. If you were referred to watch this by another person other than myself, that person, get in touch with them and they'll provide you a link to the correct ordering site. And if I have any new customers on the webinar that want to order, they can go directly to my website. And I'm just going to show you, I'll just take a look there because I'll show you what this looks like, the new Bone Fortify. I'm just going to judygilman.com now for those of you who might not be able to see and are just listening on the phone. If you click here, it just says order here, so you can order, and then on my website, and whoever is directing you to their website is going to tell you, and you know yourself if you are a preferred customer, if you have your own account, or if you have a wholesale business account. That just explains the differences. But just clicking here will take you to the site that then you can choose your preferred customer or the wholesale business. And when you continue on to that initial order, you're going to click up here on Build Your Own if this is your first time ordering. And then you can just do a search right here, And so I'm just loading bone, and here's Bone Fortify. And you can see here the picture up at the top of the container that it comes in. It's a berry flavor, so that's why the berries are on there. Tells you a little bit about it. And if you want to order that, it gives you this is the preferred customer price, and you can just add that, and then your quantity goes in there, and you just continue on and put the rest of your information in. So I just wanted to show you what that looks like on the website. Sometimes when people haven't been there, it's a little confusing. So that's something I would really, really encourage you to do. This is the most cutting-edge calcium vitamin D replacement on the market. And I can't conclude this without speaking just a moment about balance and hormones. Hormones are involved in all of this. If there's an excess, the soluble fiber is going to soak up those excess hormones, carry them out. People with fibrocystic breast pain, that is often relieved with balance. The menstrual cramps many people experience are decreased. If people have polycystic ovary syndrome, PCOS, that's, women have excess body hair and acne, they're overweight, they become very insulin resistant. So balance, again, is going to normalize those insulin and leptin hormones and even increase their ability to get pregnant if they desire. So I just had to mention that in this talking about hormones. So again, in conclusion, I'm just going to say that starting in January 2015, New Year's resolutions, everybody wants to be healthier. Everybody wants to improve in whatever way is individual for you. And in my many 30-plus years of clinical practice, I dealt with so many chronic diseases, trying to put Band-Aids on them and help people. But you've got to understand that most of these are reversible, controllable, preventable, but people need the tools to achieve those goals. Thousands and thousands of people have successfully completed the 12-week transformation program. Every Monday night, I just want to share this with you, you can dial in and hear live interviews with people who have completed this program. They tell their stories, their life-changing stories, and the results that they've had. So the number here is 805-399-1200. And the access code is 524303#. So you can do that, and if you want to sign up, again, I'll send this website out. Anybody who's thinking about this transformation program, I strongly encourage you to go ahead, get signed up. Maybe you don't want to start it until the 1st of January, 2nd of January. The coach will call you. You will determine when you're going to get started. So very easy to do that. But I'm just passionate about this program. And I had a question from somebody about where in Missoula the lab is that you can go in. There is one at Community Hospital in building number 2 on the 1st floor. And I believe it's called First Lab. And then there is also another one out on Palmer that I can't remember the name of right now. But yes, they both are. Just walk in and you can get that done. So thank you so much for joining me. I went a little longer today. This topic is just loaded with so much information. So I hope that if you'll take a chance maybe to go back when the recording's available, I'll send it out to those of you who I know are on live. And for those of you who may be listening to the webinar recorded, you can go to my website, judygilman.com, and there is a page where the recorded webinars are. So you can just click on that and you can listen to them there. So thank you so much. This formally ends the webinar.